again to Health Focus with Amy, a platform where we majorly focus on health careers, health equipment, and everything health. In case there is anything you want us to focus on, comment down below. And if this is the kind of content you like to view or see, why not subscribe and share and like so that we become a community focusing on proper healthcare in our country, Kenya. So last time we had our cardiologist telling us about his story, and we promised to bring him back to tell us what he's doing right now, and he's here. Dr. Ndwiga, welcome.
Thank you so much, Amy. It's good to be back.
Thank you. So we were talking about cardiology, and you are a cardiologist, and kindly tell us, this cardiology, yes, you are in Nairobi. What part of Nairobi, and what exactly do you do on a daily basis?
What I do is I start my day, usually around 8 o'clock I'm already working. I normally do the ward rounds at that point. Based upon where I have clients, I go over to where the clients are and have a look at them. And then sometimes I have operation. I finish the operations and I make it to my clinic. I spend most of the time in my private clinic actually. And from there I either take care of patients as outpatient, or the ones that need inpatient care, I refer them, or I plan and book them for procedures in any of the hospitals that I've actually mentioned.
So you are an entrepreneur in healthcare?
Yes, I am.
In entrepreneurship, you are focusing on cardiology or the total healthcare of a patient?
I'm a physician, cardiologist, also electrophysiologist. I end up taking care of diseases that are from the spectrum of heart disease, sometimes even heart rhythm disease, but also take care of patients who have general illnesses such as hypertension, diabetes, high cholesterol, asthma, sometimes infections. But you find that most of my patients will actually be aging or swaying towards the heart patients.
Okay, all right. So how is it in medicine? There is no curriculum I can say about management, finance, and all those things. Tell us the journey to entrepreneurship in healthcare.
I worked very closely with my mentors. From them, I learned aspects of management, I learned aspects of administration, and aspects of focus. A lot of who I am actually was formed by the people who mentored me. So that really helped me be able to crystallize my focus, know what it is that I want to do, what services I want to offer them, and at what level. Having said that, I did draw upon specialists in the field. I drew upon accountants, I drew upon finance gurus, I drew upon administrators to help me structure the business so that it would clearly be able to be an efficient business and one that is actually profitable.
Wow. How can you say the journey into entrepreneurship in healthcare is it as easy as other businesses being run in the nation, or it's a bit different?
What I would say from my experience or from this subspecialty field is that a reputation and a good name is actually what you need to get first. Okay. I've seen many of my colleagues wanting to start businesses really early or private practice really early before they're well known in the field. That doesn't really work. It's a service industry and it's a trust-based industry. So that means that, for instance, you must trust me to take care of a client. If you don't trust me to take care of the client, it's very unlikely you'll actually hand the client over to me. So a reputation, competence, and experience should actually come first. And then now having garnered that, you look for the niche or the area in which you feel you can actually provide a service that's lacking. Another important thing is that interdependence is very important. I don't work alone. You've noticed that I do have staff that I work with. I work with other hospitals so that we're actually interdependent upon each other. So I draw upon them, they draw upon me, we depend upon one another. So it's not a solo mission field. You actually have to go forward with others because the service you're offering has to be a wholesome service and has to be one that keeps regenerating itself.
What challenges will you say you faced or you are facing that you can advise a young entrepreneur in healthcare to focus on before they start?
Our main challenge actually was capital, because we wanted to offer services at this high level, and that required the equipment, it required the staff. So we started off with requiring financial support. Yeah, capital acquisition was actually a major issue. We noticed that the financiers were not willing to invest in you just on the basis of your reputation. Mm-hmm. They didn't believe that the dream I had, the name I had, was actually going to be worth anything in the market. We are getting a lot of interest right now that we're already, moving forward, established. But that is one of the areas that we actually did have a challenge. We thank God that He brought our way a business couple that was willing to invest, mm-hmm. and then we got back their money to them after 2 years.
Wow, wow, that's awesome. Apart from the capital, and getting things put in place, the rest of the things, your reputation is able to pull you through.
That's
and
the
I
main thing.
agree. People want to associate you with something that has picked up.
Yes,
Nobody
yes.
wants to start.
With a startup.
Nobody wants to do a startup. But you are filling up the need of healthcare in the nation very well, because the population you are serving could not have gotten somebody to serve them. Thank you so very much. You've heard it from the cardiologist entrepreneur himself. And for more information concerning cardiology, concerning entrepreneurship, comment down below. In case you want to reach him, or in case you want more information concerning this, write comment down below or send an inbox and it will be responded instantly. Thank you so very much and have a blessed day.